Non-fatal overdoses fell from a high of 132 in 2018 to 99 in 2020, an over 25% decrease. However, the COVID-19 pandemic brought many challenges to those facing substance misuse disorder. In 2020, Howard County saw a 43% increase in opioid-related deaths compared to 2019, part of a national and statewide trend as the COVID-19 pandemic exacerbated the opioid and substance misuse. Maryland saw its highest opioid fatality number to date in 2020 at over 2,500 deaths statewide. That trend continued for many communities in 2021 throughout our nation. In fact, according to a recent report from the CDC, quote, more than 100,000 people died of drug overdose in the United States during the 12-month period ending April 2021. That's a new record high, with overdose deaths jumping about 28.5% from the same period a year earlier. The CDC data also show that from April 2020 to April 2021, overdose deaths rose approximately 21% in Maryland. But in Howard County, we've redoubled our efforts to combat this crisis, and we've made immense progress. In 2021, non-fatal overdoses in Howard County fell from a high of 171 in 2017 to 137 in 2021, approximately a 20% decrease. Fatal overdoses fell from a high of 51 in 2017 to 20 in 2021, approximately a 61% decrease. In 2021, Narcan was administered to every non-fatal overdose. We know that to keep this number down, we will need to continue our commitment to ensure that those facing substance misuse disorder are able to receive the care and support they need, even amid a pandemic. In Howard County, we continue to follow the recommendations to combat substance use disorders, including ensuring access to care for patients with an opioid use disorder, protecting patients during the pandemic. Our health department has ably continued to work with our community partners and government departments to train more people in overdose response, including how to administer Narcan in an emergency. In the last fiscal year, from July 2020 to July 2021, our health department has trained nearly 600 people in its overdose response program, distributed approximately 550 Narcan kits, and distributed more than 4,500 Deterra bags, which allow for safe drug disposal. These efforts have resulted in real results and have saved lives. Today, we're also announcing an exciting new partnership that will support those facing opioid substance misuse disorder. Our Department of Fire and Rescue Services can now transport opioid-presenting patients directly to the grassroots crisis stabilization center rather than our hospital. Stable patients with opioid-related complaints can now be taken directly to the grassroots facility for prompt and often same-day referral to a treatment center. We opened this innovative 24/7 crisis stabilization center in December of 2019, before this terrible pandemic dominated our lives. And since then, despite the challenges of this virus, this center has been incredibly successful in supporting our neighbors in need. In 2021 alone, 72% of clients who visited the center received timely access to treatment. And we are so fortunate that now EMS is authorized to use this vital community resource. In addition to placement and recovery programs, our grassroots team has multiple resources to help patients, such as access to food, clothing, healthcare, and a safe place to stay. This innovative new initiative is one more transformational tool to combat addiction and opioid epidemic here in Howard County, connecting those in need, those who are in crisis, with the valuable resources and support they need to recover. I want to personally thank all of our partners here today, our Department of Fire and Rescue Services team, our police department, our health department, and grassroots. Our success means more lives, more families are saved. We continue to work together across public and private entities to reduce harm, get people the help they need, and bring an end to this crisis. Thank you.
Thank you so much, County Executive. Next up, we're going to hear from Dr. Ro Bonacorsi, who's our Director of the Bureau of Behavioral Health for the Howard County Health Department.
Welcome. Good morning, everyone. Thank you. The Howard County Health Department works with all populations in the county to link those struggling with opioid misuse and other substance use disorders to resources. Our goal is to prevent all deaths and other adverse events related to substance misuse through harm reduction and guidance to develop recovery plans for individuals who are using drugs. Health Department activities also include linking those seeking referrals to treatment services to a behavioral health navigator, meeting people where they are in their recovery journey with harm reduction services and supports from our peer recovery support specialists, and training first responders and community members to identify and respond to a potentially deadly opioid overdose by administering Narcan. Our opioid overdose response program, which trains community members how to identify and respond to an overdose, is free and open to anyone who lives, works, or goes to school in Howard County. Free Narcan kits are available to participants. If you or a loved one are struggling with substance use or a mental health challenge, anyone can call our behavioral health navigation team at 410-313-6202. You can also seek information on our website, howardcountymd.gov/gethelp. Thank you.
Thank you so much, Dr. Bonacorsi. And next up, we're going to hear from Chief Gregory Durr from the Howard County Police Department. Chief Durr?
Thank you. I'm glad to be here today to be part of this announcement that opioid overdoses are down in Howard County. I'm also enthusiastic about the new program to connect people in need of opioid services directly to grassroots. Here in Howard County, we truly have a multifaceted approach in which public safety works closely every day with partner organizations like Grassroots to fight this ongoing pandemic. Our police officers and fire department personnel are on the front lines of this fight every day. We're responding to these overdoses and seeing people in their most desperate moments. We're using Narcan and other tools to try to prevent someone from losing their life and their families from losing hope. Too often, we are seeing the same people in these overdose calls, watching them being loaded into the same ambulances, taking them time and again to the hospital, only to see them repeating the same cycle a few weeks or even days later. This direct referral from ambulance to treatment services through grassroots can help us change that. The goal of these intervention efforts is to keep people from misusing drugs, which not only benefit the person in recovery, but benefits our community as well. It creates a safer environment for everyone and helps decrease the likelihood that a person desperate for drugs may commit crimes in our neighborhoods. These are real solutions impacting real people living right here in Howard County. We're pleased to save our neighborhoods in need and encourage them to fight to save themselves. As the new police chief, I am committed to working with all of these partners to make this a top priority. We are not immune to this pandemic, this epidemic in Howard County, but we are taking important efforts to move in the right direction. We will do all we can to help bring about change and help those who need us most and give them the tools to help themselves. Thank you.
Thank you so much, Chief, and welcome aboard. Next up, we'll hear from our Fire Chief, Chief Lou Winston.
Good morning, and thank you all for being here. We at Fire and Rescue appreciate the continued partnership among the County Administration, Health Department, the police, and grassroots as we work to provide another vital service when it comes to combating the opioid crisis. Our partnership with grassroots is part of the State Opioid Response Program and is only the second EMS program in the entire state that takes stable opioid use disorder patients directly to a stabilization center as an important bridge to treatment. Being a part of the State Opioid Response Program allows us to quickly transport patients to appropriate facilities that have protocols in place which are well suited to address a patient's specific needs, essentially getting the right patient to the right resources. If a patient is stable and does not require emergency medical care and voluntarily agrees to be transported to grassroots, we will provide an alternate, effective solution that rapidly places them into a treatment program. A recent Harvard Medical School study concluded that 75% of people struggling with addiction do recover over time if given the proper support and resources they need. Our EMS providers play a role in getting these patients swift access to necessary streamlined health care. While there is still more to be done to help support these individuals who are battling addiction, this partnership is another tool to give people the chance to heal and start on the path of recovery. Thank you.
Thanks so much, Chief. And last but certainly not least, we'll hear from Dr. Mariana Israelson, who is the Executive Director of Grassroots. Dr. Israelson?
Good morning. It is indeed good news that there has been a decrease in overdose and death from the opioid use individuals who suffer with opioid use disorders in Howard County. This would not have happened without Howard County's government's focus on this issue. We are grateful that our county has been leading the way, identifying strategies and resources to support individuals seeking help for opioid-related disorders. As Howard County only 24/7 Crisis Intervention Center, Grassroots only knows too well the need to control the opioid epidemic. We see its victims we have been watched the recovery of people who have received treatment. The state opioid response program at grassroots has proven successful getting patients into treatment programs. 75% of the patients that we serve successfully enroll into treatment. This is an incredible goal to meet, and we are extremely successful or obtaining that goal. Providing access to grassroots is critical component for that success. Individuals that are able to connect with the resources very often have a possibility to recover. We are glad to be in partnership with Howard County Department of Fire and Rescue Services on this valuable initiative. Having them transport people directly to grassroots crisis intervention as an alternative to the hospital allows us to provide immediate care to individuals suffering with opioid use disorders, treatment for withdrawal symptoms, and the ultimate goal for referral to recovery program. Our services allow individuals the access to care that they desperately need. I would like to express my eternal gratitude to Dr. Calvin Ball, Howard County Executive, Dr. Roe Pankarsky, Howard County Health Department, Chief Gregory Durr, Howard County Police Department, Chief Lewis Winston, Howard County Fire and Rescue, and the two individuals that have made this partnership possible when I reached to them in a simple phone call, David Sabat, Battalion Chief, and Dr. Mario Levy, Medical Director of the Office of the Fire Chief. The entire team at Grassroots thanks you, and without you, the support for this effort would have never been possible. Thank you.
Thank you so much. I think that through all of our speakers, we've gotten a real kind of look at the great trends that we're seeing here in Howard County and also the continued efforts to work towards recovery and that continuum of care. As we're kind of closing up here, I just wanted to ask the media again if they have any questions to please either just go ahead and speak or raise your hand if that's an option. Do we have any questions from the media? Doesn't sound like we have anything else. Dr. Ball, do you want to give any other closing remarks before we wrap this up?
I just want to thank everybody here on the call and your teams who have worked to make this vision a reality. The work that we're doing here is saving lives and is transforming families, and it is meaningful, especially during this time when we all need a win and we all need a little bit more hope. So thank you so much, and take care of yourselves this week.
Thank you, everyone. This concludes our press conference.